better sleep, sharper focus, a healthier life. It all starts with how you breathe.
Welcome to the No One Told Me, the Airway Health Connection, the Untethered Way, where better breathing meets better living. I'm Dr. Meggie Graham.
I'm Dr. Liz Turner.
We're the co-founders of Untethered Airway Health Center,
on a mission to help you breathe freely and live fully through proactive airway health.
Whether you're a dentist expanding your airway expertise,
or a family looking to sleep and breathe easier,
you're in the right place.
Each week, we'll bring you bold insights, real-world stories, and expert tips.
All to help you take control of your airway health. Because when you breathe better, you live better. Let's get started. Hey everybody, I have this unique gift of being able to record this episode outside in the winter with no sleeves on. I shed the sub-zero Wisconsin weather for some pretty mild California sunshine. I keep stretching, trying to get to the sun like a cat, looking for a nap spot. But man, is it beautiful. I'm actually with Liz. We're at an oral surgery, airway focused forum, and it's just unbelievable. We'll share more about that in our online platforms. But I want to jump into what's been on my mind. I wanted to record this episode because I've been having a few really interesting conversations recently that I find myself circularly thinking about. I find them genuinely fascinating. They're not swirling in my brain in a bad way or a stressy way. It's just really interesting to me. And what it's making me reflect on is how patients, or all of us, just how differently we all arrive at the readiness to intervene, accept treatment, or make the not passive decision to not do anything when we are faced with a problem. For example, in my world, in our world, somebody finds out that they have dysfunctional breathing. Are they going to choose to act? And if they're going to choose to act, are they going to look for a Band-Aid solution, something to control things, or are they going to try to get to the root cause? Sometimes we have patients that are coming in looking for answers, and their thought process and decision-making and value are going to be something completely different than somebody that has no idea that they have a problem or just don't have any major chief complaint. So these conversations I've been having recently are with two specific people who are near and dear to me, people that I love, and people who know me well and have known me for a long time. People have watched my professional journey unfold in real time. And honestly, they are absolute airway patients, like textbook. They know that they're airway patients, but they are not kind of borderline cases. And from my vantage point, there's a lot of things going on systemically for each of these patients that are connected. So back to the purpose of wanting to talk about this on the podcast is because it reminded me of something that I think is really important for all of us, providers, patients, family members that's supporting somebody through a journey, maybe a spouse or a parent. The body is unbelievably good at compensation. We're so good at cheating. What I mean by that, when somebody has struggled to breathe well for most of their life, or maybe all of their life, they often have no idea that they're struggling at all because the body has stepped in and just figured it out using dysfunctional compensations. The body just adapts. It finds workarounds. It shifts patterns, how muscles are being recruited, how the jaw is being postured, where the tongue lies. It alters sleep architecture and sleep position. It does whatever it needs to do to survive. And those compensations, while are keeping us alive, can carry with someone for decades, years and years, and keep shifting and might not be problematic enough to create a complaint. But eventually, for most people, those compensations hit a tipping point. And that tipping point looks different for everyone. For some people, it might be pain. For some people, it's fatigue. For some people, it's just awareness of poor sleep or difficulty breathing. For some people, it's their teeth or their dentition just breaking down, failed restoration after failed restoration, maybe loss of tooth structure or actual teeth. So there's no single moment that wakes everyone up, but there usually is a single moment that wakes somebody up. But what I'm realizing is I'm seeing it, is that I see the problem, I connect the dots, I value the recommendation, and what the patient's experience is might be so different. So creating value for intervention, especially when we're talking about airway correction, fixing the dysfunctional breathing, making breathing more optimal, or if you're going to go down the road of orthodontic or surgical treatment, it's really hard when someone is not there yet. They don't have the vantage point to know how much better life could feel or how much those compensations are actually influencing and costing them. I think that aha moment might seem obvious, but I'm so immersed in this world that I forget that it's a process. And it was a process for me to learn it. It was a process for me as a patient. And I have to be able to give information, let patients digest it, and then have their tipping point moment if they're going to follow through with any sort of intervention. The details of these stories really matter. Both are adult males in their 40s. Both have obstructive sleep apnea. Both of these patients have dysfunctional breathing patterns. Both would benefit from addressing the muscle dysfunction. They both have tethered oral tissues, and they're both bimaxillary deficient, meaning that they have jaw bones that are in the wrong spot in their face. Their upper jaws are narrow and set back, and their lower jaws are long and set back. They're both jaw surgery candidates. For me, seeing their airway anatomy, their symptoms, their quality of life, and their long-term risk is one thing. It's really easy for me to make recommendations and stress the importance of something, but for them to connect those dots and want to do something about it is entirely different. For one of them, he's known about his breathing issues and his sleep apnea for years. He does not connect his sleep apnea to difficulty breathing during the day, but he's constantly congested from what I've observed. He's worn a CPAP for a really long time. He's tried positional therapy. He's tried different devices to keep him from sleeping on his back. He's very aware that he has issues while he's sleeping and breathing, but dentally he presents okay. He has a full dentition. He's got all of his teeth. They don't look terrible. He's had a couple of cavities in his life. There's no dramatic attrition or wear on his teeth. Does not have any obvious erosion, but he does have a narrow mouth. His compensations aren't jumping out at him from inside of his mouth the way that they would with some patients. For years, when I would see him for hygiene visits and checkups, there was not a lot of firefighting to be done, no major dental intervention that was necessary, and no buy-in from him to do anything to get to a more stable foundation. I would say things like, do you see how narrow your roof of your mouth is? Do you see how your teeth are all tipped in? This is connected to how you breathe. Would you want to do something to, prevent long-term risk? But this hypothetical in his mind, not imminent long-term risk, was not something that he was interested in addressing. And he'd always listen and he would nod and he would say, that makes sense, but I'm fine. There's nothing really bothering me. I don't mind my CPAP. There's just no emotional hook to do anything. But I'm really wanting him to get to that preventative, more optimal foundation. As time has gone on, his breathing dysfunction has gotten worse and some other systemic issues are starting to show up. He still wasn't connecting the dots or having any sort of urge to do something about it until recently. So now he notices that he's starting to posture his lower jaw forward, especially at night. He doesn't think that his CPAP is working as well as it used to because he feels like his sleep is more restless. He's not getting great sleep. And he's very aware of his jaw position and how his teeth are matching up and that he's clenching, and he's also kind of end to end with those front teeth. And he's worried because for the very first time, he's seeing his teeth start to chip and he's starting to see some wear. And that's what scared him. He said, I've never had to do any dental work. I've seen people around me have to go through a lot of dental work and I don't want to have to do that. What can I do about this? We got to zoom out and start over and have the conversation and connect the dots now that his ears were open and that he's had his tipping point. It wasn't the apnea, it wasn't the fatigue, it wasn't the years of compensation or things that were causing systemic harm. It was seeing that his teeth were wearing and he didn't want to have dental work. So he asked me if he could get a mouth guard. Could I just get one over the counter at, a pharmacy? Can I order one online? And we talked about having something custom made, and we're going to put him in a control situation where he can stop wearing his teeth while we reopen the conversation about his treatment options. Okay, so quick little aside. This opened up a really important conversation. Mouth guards are not all created equal. They vary wildly in how they fit, what they're made of, what they're doing to the bite, what they're doing to the relationship between not only the teeth but the jaws, what it's doing to the joints, and also what it's influencing over the airway. Some guards even lock you into a position that actually increases strain and worsens things. So I don't recommend having patients buy their own guards or something that can be boiled and bit into, and working with somebody that really understands the nuance of design and can make something custom for you. That's okay. My aside is over. I just don't want you to introduce problems that weren't there or make a problem worse. With the orthotic, or the guard, if you will, that I designed and decided for him, we decided that would be a really good thing for him to stay in as the Band-Aid solution, while we figure out whether or not he's ready to intervene in a more foundational way, rather than letting his teeth wear. We're going to make the teeth fit in the joints or in the jaws in a way that is ideal to minimize the wear and tear on the teeth. Inadvertently, I would not be shocked if his breathing gets better, because we see that happen all the time, but that was not his why or his value. So now for the first time, he's open, he's considering orthodontic intervention, he's considering whether or not he'd do jaw surgery, and he's connecting the dots himself that I've been trying gently to point out for years. And it's not because I explained it better now. It's because he's reached his own tipping point, and that value has shifted. His eyes are open and he's ready to do something. The second person is, like I said, similar in age, has similar airway presentation, but his story looks a little bit different. He also has obstructive sleep apnea. He tried an orthotic that held his lower jaw forward, and while that helped him breathe better by holding his lower jaw forward, it created some significant jaw discomfort. He's tried mouth taping, but still has fragmented sleep. He knows he snores, and his partner has witnessed apneic events. So he's chronically fatigued, but there are so many external stressors in his life that it's easy to attribute his exhaustion to those things, not only to the breathing. So the apnea piece gets minimized. He puts it on the back burner, and it's easy to ignore. It's not his tipping point. It's not what's creating value to want to do something. For him, his teeth are being totally broken down. He has had restorative work fail over and over again. The tooth wear often starts really slowly. Enamel is incredibly strong. It's protective. But once a patient has dysfunctionally worn through the enamel and exposed dentin, or the second layer of tooth structure, that rate of attrition and the rate of wear accelerates really fast because the dentin is much softer. So the shortening of the teeth speeds up quite quickly, and all of a sudden becomes noticeable to the patient, whereas it might not have been noticeable before. And often when patients have dysfunctional breathing, there is an element of clenching. It's not random. It's frequently a subconscious attempt to stabilize the airway. It can also, by grinding the teeth, stimulate the salivary flow that offsets acid production and acid reflux. And all of that adds to failure of tooth structure and restorations that are put in the mouth to fix something. He's had a broken tooth that led to a crown, and then a root canal, and then a new crown, and then the tooth was taken out, and then there was an implant, and then another tooth. And he was kind of going through this, but all of a sudden the frequency in that the failures started happening increased, and one of his implant restorations failed, and he now recognizes the wear in the front teeth, and he realizes he can no longer ignore it by doing nothing, by choosing not to do intervention is not passive. Now, with his own eyes, he sees what we've been talking about for a really long time, but he's connecting the dots and he's now wanting to intervene and do something. He just said, I don't want to keep replacing single teeth if this is just going to keep happening. He doesn't want to necessarily do big intervention, but he also now doesn't want to continue to do the failing restorative work. And so the cycle has been broken. Such parallel cases, so many similarities, of course different because every patient is so unique. And both of them weren't driven to wanting to do the comprehensive treatment because of breathing. And yet both of them, if they get to the root cause and fix the bony structure, they fix the muscle function, are undeniably going to be breathing better and sleeping better. Maybe not a full cure, but when we put things in the right, we put the foundation in the right spot, it's amazing how well things function. And so the second guy, he actually had an orthodontic surgical consult, and he is committed to going through orthodontic treatment, orthodontic surgery, and he understands that he's going to need a full mouth rehabilitation. He's going to need a mouth full of new restorations, but he understands that the risk to those restorations will be so much lower when the bite is functioning optimally, when the jaws are in the right position, when he's breathing well. So he's much more willing to go through such a big treatment, knowing that the risk is decreased. So once the teeth are built back to the proper size and shape for proper form and function, we're also going to continue to encourage him to work with the myofunctional therapist so that he can retrain his muscles to work the right way so that everything that is fixed structurally or with hard tissue with bone can have a higher likelihood of not relapsing. And maybe it's not this crazy aha for anyone else, but for me it was very fascinating. Two people, similar airway dysfunction, different value tips for them as far as what made them want to follow through with treatment. And this has been such an important reminder for me as a provider, and I can see the big picture, I can educate, I can recommend, I can nag for some of these people close to me, I can plant seeds, but if someone does not connect to the value of why they would do something, they are never going to move forward with accepting treatment, ultimately making a decision to do interventions as they become acute problems. So readiness is really personal. And the other last piece of this, the overlap, is both of these men that I've been talking about are fathers. They both have children, and both of their families have followed some early intervention recommendations for their kids. You know, there's been for some of the kids, there's been phase 1 orthodontics, there's been expansion, myofunctional therapy, tongue tie releases, ENT consults, ENT surgeries. They did it because they trusted me, and I can be quite persuasive, but they wanted what was best for their kids, but they didn't really buy in because I don't think they really fully understood the why at the time. And maybe it might be my explanation, but I just don't think that they were seeing the issue. So now as they're looking at how much unwinding needs to happen in their own bodies, how much intervention is required later in life, I think they're going to start to see the value of why we're doing things earlier, not because it's trendy and not because it's aggressive and not because it's a money grab, but because it can change the entire trajectory of these kiddos' lives and decrease the risk of systemic health problems and also decrease the risk of other interventions that are much bigger deal later in life. So it's really all about the readiness. So this is really a story about timing, about readiness, and how that influences the value and when a patient will be ready. And it's not going to be just because you see it. It's going to be because they are influenced by it in a way that they want to act. So thank you for listening to my swirly thoughts out loud. I'm really excited to see how these stories unfold. I'll share with you, and I'm excited to see how they feel on the other side of their intervention. Thanks for tuning in to the Untethered Airway podcast.
If today's episode helped you see things differently,
Please share it with someone who would benefit from hearing this, and don't forget to subscribe.
want to learn more about airway health or connect with our team?
Please visit our website, untetheredairwayhealthcenter.com, or follow us on Instagram @untetheredairway.
Until next time, bye.